All right. Hey, welcome back, everybody. We're going to start in about 5 minutes here. We're just going to let some people join in. So we'll see you in a bit.
Oh, hey, I see people joining on the chat. Hi. If people have questions in the couple of minutes while we're waiting, I'll try to, I'm not signed into chat. Everybody's gonna have to excuse my technological incompetence there. Hey, you guys, just so you know, I can't answer questions in chat. So I can see questions. So if you guys have them, I'm not going to type back to you, but hey, from Kansas, California, I lived there for a little bit. Ooh, a fan of family medicine. Ooh, Dubai. Hey, that's a cool place to be. New Mexico. Yeah, tell me where you're from. I love hearing locations. Maryland, Texas, California, Georgia. It's 5 a.m. Were you the Dubai individual? Ooh, Hawaii. I've been to Kauai. I don't know what island you're on, but I love Kauai. I haven't been to the rest of the islands yet. Upstate New York. I lived near Rochester temporarily as well. Ooh, Vegas. Hey, you're close to me. I'm in St. George. Anna Maria, close to you. Ooh, Pittsburgh. I lived there for a long time. Hey, Louise.
All right. I guess we can go and
Welcome back.
That sounds good to you. Yeah.
People are prompt.
I know, they're ready. This is actually insane. So the reason we do the 5-minute wait thing is just to let people in. We usually start at 100, but we're already at 200. So everybody clearly loves you.
Oh God. Hey, hopefully I live up to everybody's expectations.
Yeah, but just real quick, guys, we just wanted to thank you. Welcome back. Thank you so much for being here with us. It's going to be a really good presentation. As always, the quiz will be posted at the end. You have an hour to take it. 5 questions, super straightforward, nothing tricky. We'll give you more info on that to the end. We don't want to cut into Danielle's time too much. And then the only other thing is, she's going to be keeping an eye on the chat, but if she misses any questions or anything like that, I'll always record them. So feel free to be active as you want. We love to hear your comments, see your reactions, questions, anything at all. But yeah, so we'll be right here if you need anything from us. And without further ado, I think it's all you.
Yeah, for sure. Thanks, guys. Thanks for having me. Someone asked where in Pittsburgh. I lived kind of all over Pittsburgh for a little while. I was in and out of there for about 7 years. So the only place I pretty much didn't live is north of the city. So wherever you live, I've probably been there and know the area. But I've never done a YouTube live. So if I get technologically uninclined, everybody be a little patient with me. I also told these guys that I'm actually on call for work right now. So if I have to pause and take an on-call, please bear with me. But my name's Danielle Kepix. I'm a physician assistant. I work in family medicine in St. George. I spent most of my career prior to taking this permanent position, actually doing locum tenens work, so traveling. And if anybody has questions about that, everyone always does. I'm happy to answer them. So hit me up. I'll have my contact info, or you know, if there's questions in the chat, I'm definitely not going to be able to follow the phone and what I'm talking about. So, but I will definitely, if you hit me up by email or Instagram, I'm more than happy to help anybody with their journey for sure. So just a little bit about me, some boring stuff with my professional headshot. I finally had professional headshots taken this year. I went to Westminster College and Chatham University for a lot of studying in counseling psychology. I was actually, fun fact, a mental health therapist for a short stint of time before I decided I wanted to go to PA school. So I used that a ton in family practice. Like I said, I did most of my beginning of my career as a locum PA. So I did work outside of Rochester, PA, Northern California. I worked just a little bit north of me in Cedar City in Utah. And then in Eastern Pennsylvania too. So I've kind of bounced around all over the place. I'm super active. I love to be outdoors, which St. George is a great place to live for that. Really anywhere in Utah is really great for that, but it's nice and warm here all year round. So I love that. I'm into weightlifting, running, mountain biking, backpacking. My dogs are like my life, as you can see on the first page there. I had to get them in there. Yeah, and I started a podcast this year too. So if you want to check that out, it's called Strong and Unfiltered. And if anybody has a cool story that they want to share about adversity or struggles or things that they've been through, hit me up on that, because I'm always looking for people to come and chat. And I also did an episode about my whole travel PA experience as well. So, all right. So why do I work in family medicine? Fun fact, when I thought I was going to go to PA, when I got into PA school, I thought I was going to be either an orthopedic PA or a trauma PA, because I was like, I'm into all the hardcore shit. Like, none of this boring. Can I swear on this? I'm sorry. None of this boring family medicine. That stuff's boring. So disclaimer, if family medicine is boring, you're definitely not doing it right. I see everything from people who are suicidal to people with menstrual health problems, which you guys are going to see a case on that. I have a huge passion for women's health and helping women understand their bodies better, to, managing diabetes, helping with weight loss, doing a lot of stuff with nutrition. I have a lot of educational background in nutrition as well. So I really bring all of that into family practice. Like I said, it addresses the whole human. I'm all about wellness and prevention and educating my patients. I could spend hours educating people. I love it, love it, love it. I always promised I would give back to the pre-PA community. So this is why I'm so excited to do stuff like this. And you get to continuity of care was the last thing I had there. I have done hospital work. I've done urgent care work, and I do not like the treat and street. It is not in me. I'm just always like, well, what happened to so-and-so? And what's their story? And well, what about this? And everyone always had to like kind of slow me down and be like, just this one problem, Danielle. I'm like, but this one problem is not what's going on. The whole body and the whole systems, like our systems don't operate independently from each other, which I'm going to talk about. So disclosures, everything I say, I'm not even going to tell you guys who I work for, because I'm so used to doing that with the podcast. So there's no financial ties. I don't have any incentives anywhere. And my views are always, of course, my own. So let's get into topic case presentation. This 44-year-old Hispanic male is one of my favorite patients, and he's one of the most kind and happy people I've ever met. And so are his children, and they're super well behaved whenever they're in the office. So I always appreciate that. You guys are also going to get a lot of sidebars with me, because that's just how I am. So he came in, fatigue, joint pain, irregular bowels, just kind of not feeling great, all this brain fog, and it's been going on and off for years. And so you're going to see my HPI here. So HPI stands for history of present illness. I didn't go through the whole like onset, duration, location, quality, quantity, aggravating, alleviating. Those are things that you guys will learn in PA school, or if you're already in PA school, you're doing those things. So you always kind of want to pay attention to like, when did it start? What makes it better? What makes it worse? Maybe you guys know some of this, maybe you don't. I may be talking over or under some of you. So hopefully I'm hitting in the middle for most people. But he's had this like intermittently for a lot of years, but recently it had been getting kind of worse. And he kept saying it's my hands, like they're just achy, they hurt. And this brain fog, he just didn't feel right no matter like how he was sleeping. Constipation, bowel movements are super important to your health. FYI, you should have a bowel movement every day. Your patient should have a bowel movement every day, even if they've only had one bowel movement every 3 days for the rest of their life. For all of their life, it is not normal, even if it is, quote, normal for them. That is how we excrete our toxins, and that can cause a lot of problems, from anything from estrogen detoxification to just generally how we feel and the toxins that build up in our system. So his main complaint was really that joint pain in his hands. And I had come to find out that he did have a family relative or family history of his mother with rheumatoid arthritis. So that was really at the top of my differential. I'm kind of getting ahead of myself, but he had attempted a number of things, the regular Tylenol, ibuprofen, conservative measures, ice, heat, but nothing was really affecting it. And so his occupation was he traveled a lot for work. He did a lot of sitting. It's not like he was working extensively with his hands. So anytime anyone has like some type of musculoskeletal complaint, it's always, okay, do you have a known mechanism of injury, which I didn't put in here, but he didn't have. What do you do with that? Which hand is your dominant hand? Have you ever had surgery on that area? And then you want to ask also about the joint above and below. So your hand, there's not really, his fingers, he had those affected too, but there was nothing really wrong with his range of motion with his elbows, his shoulders. He walked fine, had really no other musculoskeletal complaints. He didn't have any like alarming symptoms such as fever, chills, weight loss, anything that would make me think like, okay, like this is some type of autoimmune flare or cancer. And he just really sat a lot for work. He did a little bit of mild physical activity, walking, being active with his young children. These are the things also, in addition to the history of present illness, that I go over with individuals. These are what I call my 5 foundations of health: sleep, stress, nutrition, exercise. I also put it as movement for people, because a lot of people think that exercise has to be done in a conventional gym, and it doesn't. You can do anything as long as you enjoy it. But and relationships. Fun fact: studies are showing that if you don't have close and quality relationships, it is actually as unhealthy for you as smoking a pack of cigarettes per day. That statistic just blew my mind. So, and I think we're seeing a lot of that, side note, in the pandemic right now, where just people are feeling really disconnected, very lonely. There's a great book out there called Together by Vivek Murthy. He was actually the 19th Surgeon General of the United States that talks a lot about this. I love that people are guessing ankylosing spondylitis. I love that people are guessing things. I just caught that. So he sleeps, feels rested in the morning. So another thing I usually kind of think of with like any type of feeling fatigued and just like feeling brain fogged is obstructive sleep apnea. Another thing that I look for with obstructive sleep apnea is like, does this person have totally uncontrolled hypertension? Like if they're below the age of 40 or over the age, or I'm sorry, below the age of 30 or over the age of 50 with a new diagnosis of really uncontrolled hypertension, definitely think sleep apnea. But he felt great. He didn't feel like he wasn't having like daytime somnolence or anything. And like I said, this guy is one of my favorite patients. He's super happy-go-lucky, minimal stress in his life, has a great supportive wife, loves his children. He's just so incredibly happy. And happy people can be depressed and they can have stress too. It's a really important thing to keep in mind. But did the 5 core things come from PA school? No, those came from me. That's a Danielle Kepik's original. I'm sure other people do it, but no, I inputted that on my own, and that's in every history and physical that I do. So, but yeah, I mean, he liked his job. He has a great life, friends, supportive relationships. Kind of, I wouldn't say he ate the standard American diet, and he was eating most of his meals at home, but admitted like, I could probably be eating healthier. And be getting more physical activity in. He was, like I said, he was a little overweight. The BMI, I don't think is the end all be all, which is a whole other conversation. You guys can hit me up privately about that. We can chat, or we can do another live and chat. Infrequent alcohol, just socially, like really responsible, just a couple drinks a month. No tobacco, no substances ever. I always make sure in my histories, like when people say they're not a smoker, well, did you ever smoke? Did you ever do drugs? Were you ever a drug user? Were you ever, significantly into alcohol? Because those histories can matter. Like, yeah, maybe somebody today walked through your door and they're not smoking today, but they're 60 and they smoked for 30 years. So like that history matters, So, so like I said, mom with history of rheumatoid arthritis. There was some other family history in there too. That was really the only thing that I found pertinent to kind of what I was formulating in my head. I think he had like diabetes and hypertension in his family history as well. Mental health, I always, my mental health background, always ask about mental health. I cannot make this point enough that whatever specialty you go in, it affects everything. And so for me, I personally ask people, do you have a history of anxiety or depression? Have you ever struggled with it? Have you ever had a psychiatric hospitalization? Have you ever had a suicide attempt? Have you ever been through any trauma, physical, verbal, emotional, sexual abuse or trauma, anything? Like, they're hard questions, but they're super important to be asked. I'm just checking out the questions here. Yes, the book, so lots of people asking about the book. It's called Together by Vivek Murthy, Vivekmurthy. It's a really great read. I actually just finished that. So just scrolling through here. I love your honesty. It's so refreshing. Oh, Jillian, you have no idea. All right, so physical exam. It was really, it was really benign. Like there was nothing really going on. I did a full, workup, felt his hands, seeing if there was any tenderness to palpation. He had full range of motion of his wrists and the rest of his upper extremities. Nothing going on anywhere else. You can't just say normal for anybody who doesn't know that. So his vital signs were totally stable. I don't remember what they were. He was totally comfortable and happy. He had a great mood. Lungs and heart sounded great. No lymphadenopathy or anything going on like that. So, and the little, just so you guys know, the no SIHIPDW, that stands for suicidal ideation, homicidal ideation, or passive death wish. For every patient who really, I try to chart that on most of my patients. We do like a PHQ-2 and a PHQ-9, which are depression screenings on individuals. And especially if they're having any type of like acute struggle with mental health, I will ask that and I will chart it. One, I want to ask and I want to see what's going on with that patient, but also to cover myself and say like, hey, I asked them about this and they told me no. So it stinks to like kind of have to think like that. But it's the harsh reality of medicine. I ask because I care, but I also ask and document because it's important to do. So points on forming a differential diagnosis. I don't know how much anybody knows about this, but so when you start to think about like, okay, what is this patient suffering from? That starts to form like your workup and what type of diseases you're going to be looking for, diagnoses, I should say. Horses and zebras. I'm sure if anybody watches Grey's Anatomy, like, it's my comfort show. Can I just say that? Like, I have the question of like, do you have a series that you rewatch and why is it Grey's Anatomy? And I still can't watch the episode where Derek died. I still can't do it. It's like devastating to me. Anyways, so look for horses and zebras. So horses are the things that could be most common. And those are the things that I kind of like to start working up first. And if I don't get answers from the horse workup, I will work up zebras. I want to be thorough, but I also don't want to cost the patient and the healthcare system more money. So for me, I was thinking, okay, you're fatigued, you have joint aches, you're not feeling well, your hands really hurt. So I'm definitely thinking rheumatoid arthritis, as I mentioned before, because he has a family history of that, right? Like genetics are not the end all be all either. We can talk about epigenetics probably another day. I'm also thinking thyroid things. Thyroid affects every cell in your body. I'm very passionate about people running a full thyroid panel. So TSH, free T3, free T4, and thyroid antibodies. A TSH does not give you a complete picture, and that is not taught in traditional allopathic medicine. Fun fact, your T3, your free T3, is the most active form of your thyroid hormone. So it's super, super important. Hey, thanks, Jordan. When you hear hoof beats, think horses. Yes. Something I always consider with these strange constellation of symptoms too is celiac disease. Celiac, although it's a gut disease, it literally affects everything. It affects if you can gain weight, absorbing nutrients, how you feel, brain fog, joint aches, all of these other things. So celiac was on the top of my list also for this. Also other things like vitamin D deficiency, B vitamins, if you're feeling fatigued, magnesium. Magnesium is important for over 300 enzymatic reactions in the body. So I'm always testing magnesium. It's also really important for menstrual cycle health for females. So I'm recommending magnesium a lot to my patients, specifically magnesium glycinate, because it is the most bioavailable, which means your body uses it the easiest. So what's most likely, where am I here? Consider all organ systems. So don't limit yourself. Try to think a little bit, just like chest pain is a really good example for that. You know, if somebody's coming in with chest pain, it could be indigestion. You know, they could have GERD. So just because it's located there doesn't always mean that it's, you know, they're having a cardiac issue. And like I said, you know, the initial workup should be complete, but not like 100% comprehensive. Because then, yes, I said glycinate, magnesium glycinate, and you spelled it correctly. Yes. Awesome. Thyroid issues. Is mental health screening exclusive to family medicine, or is it present in other PA field specialties? I don't know what other specialties do. I know I didn't do it in urgent care, and I don't know what they did on intakes in like hospital medicine, like when they come in through the ER. I don't know. That's a good question. I do think it is important for every aspect of medicine though. So what did I do? Diagnostic workup. I ordered a CBC, looked at red cells, white cells, CMP, kidney, liver, electrolyte function, full thyroid panel, as I talked about before. I listed it out there. Celiac panel. I also looked at, I didn't even put rheumatoid factor on there. Sorry, guys. But I did check a rheumatoid factor and an ANA, I think, on him, and like a Hep2 ANA. If you're ordering an ANA, it's kind of non-specific, the rheumatologists say. So they say to add on a anti-CCP antibodies to kind of see if it's a true positive. I don't know if that's exactly how they word it because I don't work in rheumatology, but rheumatology sent us out this little nice cheat sheet that I love. And so if you're ordering a Hep2 ANA, they always want you to order the anti-CCP as well. So, oh, and the other thing I consider with men and or women, I consider their hormones. Your hormones literally rule your life. I cannot tell you how much. I did not do a full testosterone panel on him. It was something I was going to consider in the next round of workup if we didn't get an answer, which we did. So what's in a full testosterone panel? Just FYI, I don't know if I put this on the next screen or not. I didn't. But it is a bioavailable I'm going to have to pause 1 second, you guys. I have a call for work, so I'm going to exit out for 1 second. I'm so sorry.
No, you're totally fine. No worries.
It'll take 1 second. It's a Billy Rubin level, you guys. I'll be right back. I'm sorry.
No worries.
I'm sorry. I'm going to mute myself.
Yeah, I'll drop your screen off here. Yeah, I don't know if she mentioned, but she's actually on call right now. So, I mean, that just goes to show how awesome she is taking the time to do this kind of stuff while she's working, you know. So we definitely appreciate her doing this. But yeah, guys, so sorry about last week. I know we were supposed to have a session last Monday, but you know, life happened and around the holidays and stuff. So we planned on rescheduling that one that we had initially planned, but we're probably going to go back to the 1 a week type thing. But yeah, we should have one next week, the following week. We're working with a lot of PAs right now, different specialties, all that good stuff. So, and it looks like Danielle is giving us thumbs up. So I think she's almost back here. But yeah, guys, good questions in the chat. If she did miss any of them, I mean, obviously it's hard to present and then look at the chat at the same time. I'm recording all of them, so feel free to ask anything anytime, and we'll kind of ask her them during the Q&A session at the end.
Oh, and yeah, Laura, that's a great idea. If you guys want to take some guesses as to what it is, feel free to do so. I think she'd really enjoy looking at that too.
Yes, yeah, good call. Thank you, guys. Support is everything. Like, y'all are seriously awesome. Thank you so much. Oh yeah, for sure, Vega. We'll link her Instagram. We highly recommend you follow her. She's really interesting.
Yeah.
She does like a mix of cool facts about herself, medical information, you know, travel, health, all that cool stuff. So we're gonna plug it at the end. Highly recommend you guys take a look at that. I'll go ahead and say it right now. It's Danielle.marie.pac. Let me type it into the chat. Will you put it in the chat?
Yeah, that's what I'm working on. Okay, let's see.
Okay, cool. So that link is in the chat. It also shows her podcast that she was talking about, if you guys want to take a look at that. And I think she's just about finished here.
Hi, Lorna. That's totally fine. We don't mind at all if you share our posts. We appreciate it. That's so sweet of you. Thank you.
Yeah, thank you. I know. Perfect time to stop, right? The suspense. You got to pause for suspense.
Oh, good.
Can you guys hear me?
Yep.
Yeah, perfect.
Oh, I didn't have my volume up. Can you hear me now?
Yeah, we can hear you.
Oh, there you are. Okay. All right, we're good. It was just a Billy Rubin. We're good.
Okay, nice.
Awesome.
So do I have to get my screen back up here?
Yeah, you'll just hit the share screen
Okay.
button again.
Okay. Sorry about that.
Oh, no worries.
It's totally fine.
Yeah, I was
I'm
saying,
glad it was something easy.
definitely. And again, we appreciate you taking the time out when we know you're on call.
Yeah, no, I love doing this stuff. Seriously, I'm such a weirdo.
I mean, we can tell you're having a blast. Your
Yeah.
personality's really coming through. You're awesome.
All right, we're good.
Okay.
Are we good?
Yes, we're
Yes,
perfect. Yeah, we can see.
Everybody can hear me? Okay, awesome. Sorry, guys, it was just a Billy Rubin level. We're all good here. All right, so we're talking about my little 44-year-old Hispanic male friend here. All of his labs look pretty good. He did end up having celiac disease. So this is one of these things where if you have weird complaints, I'm testing you for celiac disease. Like if you feel dizzy when you stand up, if you have joint aches, if you have brain fog, I am testing you for this. It is like this dark horse that shows up in like all of the random places. He also had some vitamin D deficiency. I don't know how people are vitamin D deficient in St. George because the sun shines like 300 plus days a year. I'm like, y'all need to get some sunshine and eat some dairy. But the struggle is real here. So vitamin D is super important for a lot of things, from your bone health to fertility, to your mood, to your sleep, literally everything. And he had a little bit of B12 deficiency too. So I put him on a B complex, 2,500 IUs of, I didn't say what I put him on there. I think I did for the next one. 2,500 IUs of vitamin D daily and a B complex. So all of the B vitamins, not going to hurt him, and recheck those in 3 months. And then for the celiac, so what is celiac disease? Celiac is an intolerance to gluten, and celiac encompasses so much. It is, it's wheat, it's soy. Like you can't have certain soy sauce unless it's specifically gluten-free. Barley, rye, there's like, I think some 90 different words for gluten. So I always send these people to a dietitian. I know a ton about it, but I don't have the time to educate them about it. Like even the labels that they put on foods, like a lot of those labels are BS, to be honest. And you need to look for like the certified gluten-free from like the Gluten-Free Society or whatever the name of it is. I can't think of it right now. So I always send people to the dietitian. They are an amazing resource, and they can help with everything from lowering cholesterol to vitamin deficiencies to helping your vegan patients getting their protein in, and their B vitamins, because they're significantly deficient usually in those types of things, or they're more at risk to be. I shouldn't say that, but I am a meat eater, so I am a little biased. So, with these individuals, I want to get them going. I give them resources to like, here's some great websites for gluten-free, and here's what you need to avoid. Let's get you in to see the dietitian immediately. Let's follow up in 2 to 3 months, see how you're doing, see how you're feeling. That goes into my next case. So he's doing great. I actually just followed up with him probably about 2 to 3 weeks ago, and he's like, I feel so much better. My joint aches are gone. I feel more clear. I have more energy. I'm being more active. I'm losing weight. So in his case, celiac was actually preventing him from losing weight, even though he was like walking and being active, but he said it's just really improved his nutrition as well. Diet is a dirty word to me. I don't like it because it just, to me, it suggests that people should be like starving themselves. So I like to use the word nutrition with my patients. Fun fact also about celiac disease, 50% of people who have celiac disease also are positive for Hashimoto's. So really in your individuals who have celiac disease, you need to be testing them for Hashimoto's too. I know this is a long time down along the line for you guys, but hopefully that sticks. And vice versa. If you have Hashimoto's, really should be looking at celiac if you're still having symptoms and feel crummy. Does gluten sensitivity run in families? Guys, here is my thing with genetics, all of genetics. Genetics matter, but we all, me, you, and however many people are on this live, we have 99% of the same DNA. So while your genetics can play a role, your lifestyle and your environment matter so much. And that is a study of epigenetics. It is how your lifestyle and your environment and the choices that you make and the life that you lead interact with your genes and turn those switches on or off. Okay. Now, there are some exceptions. For a long time, I had this irrational fear of Huntington's disease, which, by the way, like does not run in my family, so there's no way I can have it. Yes, Laura, epigenetics, yo. But it can. And some people who have celiac disease in their family, I think the gene is HLA-DQ8. And I think there's actually a second gene that they're looking at. But even some individuals who have celiac disease, their siblings, their parents, other relatives, some of them still don't do well with gluten. So if they have family members who have celiac and they're not positive, they could still be feeling like garbage because they just don't tolerate it well. And I'm not a gluten hater either, trust me. Something else I was going to say about celiac disease and testing for it, and I can't remember now. Hormones rule everything. Can you share your beliefs about birth control and how it affects mood? Oh, Veda, is that how you say your name? I'm sorry if I butchered that. I talk a lot about birth control and I talk a lot about hormones. It can affect your mood 100%. I'll get into that. My next case is actually women's health. So, so we'll get into that. I watched that episode of House where the girl had Huntington's. I know. Oh my God. I think that was the first time that I was like, oh my God, what if I have this? And now I'm still terrified of ALS. It's like my PA school phobia that I developed or something. I don't even know. Will eliminating or gluten benefit the health of most individuals? I don't subscribe to this. I think that nutrition, and I have done a lot with nutrition in my life. I do have educational background in nutrition. I'm not a registered dietitian, full disclosure, but everyone is very individual. And just like everything in medicine, everything in nutrition is very gray. And I like to say it depends. How do you feel? You know, if you're having weird bowel movements, if you're having, you know, issues with digestion or just really bad gas, like if you have really bad gas, there's a problem going on, like frequently, like that's not okay either. So that's a sign that like you're not tolerating something well. But for the general public, I am not one of those people who's like, don't ever touch gluten ever again. I went through a phase like that in my life. Just a little side story of, you know, eliminate gluten, eliminate dairy and under eating and those types of things, and not my ball anymore at all. But a lot of those elimination things can be really unhealthy and can cause a lot of restrictive behaviors and a lot of disordered behaviors. So I like to encourage people to do what feels good for them. What feels good for me isn't going to feel good for you or someone else. So we are all, although we do have 99% of the same DNA, our bodies react differently to things sometimes. So I think if it feels good for you, do it. If it doesn't, don't, which is kind of simple. But major difference in internal medicine and family medicine. Internal medicine is going to be like your laundry list this long of problems, lots of older age, more complicated patients. I do have a couple of patients on my panel that should probably be in internal medicine, but I really like them and they're doing good. So, you know, I'm very quick to ship people off if I feel like I can't handle it. Like knowing what you don't know and knowing when you can't handle something is so important, because if you don't, it's really super dangerous to your patients. So you cannot be ignorantly ignorant, meaning like you can't not know what you don't know. You have to know what you don't know. Um, yeah, so celiac and it can be associated with constipation instead of diarrhea. In his case, it was. Yes, Hashimoto's is when the immune system attacks the thyroid. Genetic counseling and testing is something that I don't use it a ton. If I'm looking for things like, does this person have Ehlers-Danlos? Do they have the BRCA gene, or Lynch syndrome, or something that's more obscure that definitely has like a genetic link? Yeah, I think that's a great resource to use. Breast cancer runs rapid in my family. My mom died of breast cancer, my aunt had breast cancer, and my great aunt had breast cancer. So I was tested for all of the high risk and intermediate risk genes. I was negative, but I utilized that service. So there are times when it is really beneficial. Yeah. So, all right, next case. We'll get into some hormone stuff. People are interested in the women's health. I dig. I'm super stoked about that. Time out. Can you grow into celiac? This is what I was going to say when I had a brain fart. So lots of autoimmune diseases are thought to be brought on by stressful events or traumatic events. So I knew someone who this happened. She was in a really bad car accident, no issues ever before in her life. And this was a long time ago, before celiac was really known as a prominent disease. And she was sleeping all the time, just felt like garbage, like the whole 9 yards. And she ended up having celiac disease, and she pins it back to that time whenever she had that car accident. So there's lots and lots of research going into that. And there's a great book, another book resource for you guys. It is called When the Body Says No by Dr. Gabor Mate. He's a Canadian physician. And it is about the stress disease connection. And he goes through how really just that mind-body connection, how we feel and how we treat ourselves and our mental state, how it can really, and the things that we go through, trauma or abuse or neglect or any of those things that really cause trauma, how they can contribute to disease states if we're not encouraging people to deal with them. So yeah, Rachel, full thyroid panel all damn day. So passionate about it. What does it mean to learn on the job as a PA? The learning curve is steep, and the better rotations that you have and the more active you are in your rotations, the less steep the learning curve. And I also think the better, more clinical experience that you had as a pre-PA, the better off you are. I had never taken a blood pressure when I went to PA school. My patient care experience counted for when I was a therapist. So I was like, how do you put a blood pressure cuff on? Like, I was clueless. So my learning curve was steep, which was fine. Gabor Mate is a genius. Zach, I'm reading The Realm of Hungry Ghosts right now. It is about addiction in the, I think, Lower East Side of Vancouver on Hastings Street is like apparently where they first decriminalized drugs. It's a really interesting read. So, all right. So 41-year-old female, also one of my favorite patients. I love her. She has had a rough 2020, but she is just such a sweet soul. So 41-year-old female, Caucasian, irregular and missing periods. I think she had 4 kids. I get into her history, but she has been able to achieve pregnancy in her past. So 44-year-old female with irregular menses her entire life. She's been previously diagnosed with PCOS. Sometimes have cycles that are 21 days and shorter, and sometimes they're 60 plus days and just go forever. So when she does have a period, they're just miserable. Disclaimer, your period or your patient's periods should not debilitate you. Period pain is common, but it should not be normal. You should be able to get out of bed and do your activities of daily living. Like, that is not okay. Changing pads every hour to 2 hours or tampons or menstrual cups, not okay. Clots bigger than the size of a quarter, also not okay. So she was kind of having all of these things, just really bad mood swings and acne and feeling like garbage and PMDD and just fatigue and the whole 9 yards. Like, she had the whole garbage trash can of how you feel if you have like the worst period of your life. So She had had 4 children, and she struggled with infertility. So she had been through a number of fertility treatments. I have only been seeing her for the past year, so I don't know her entire infertility history. But she had gone through a number of, IVF or, different induction methods to try to get pregnant. But so I don't really have anything else about her medical history in here, I don't think. Sorry, guys. Let me look through here real quick. I'm gonna skip around a little bit. Sorry. So her past medical history, she has hypothyroidism. She lots of trauma for this gal. Even just this year, she was raped and assaulted. She was robbed. Like, just the girl has had a bad couple of years. She left a very damaging marriage where she was seeing like the same physician that her husband was seeing, and it was the husband's friend, and he was like over medicating her. She was on all of these antipsychotics. It was so much badness. She has a lot of insomnia, probably from the PTSD. I think that's all. I think that about covers her. So let's see here. That goes through her medical history. We'll just go through the rest of this, and I'll go back to the other slide. So she was on sertraline, levothyroxine, and Ambien, and when I first saw her, she was on, I think, Seroquel and a couple of other medications that I was like, whoa. Like, this is, we need to chat. She was definitely over medicated, and we tried to wean her off Ambien, which I talked about on the previous slide. Levothyroxine is a thyroid medication. For those of you that don't know, levothyroxine is more similar to a T4 compound. Your T3s are going to be more like Cytomel or Nature-Throid. You can also do like bioidentical. Your compounding pharmacists are amazing people. And sertraline. So she was on a pretty high dose of sertraline and had been on this for some time. Fun fact about sertraline, it can actually elevate your prolactin levels, and prolactin levels, if they're too high, won't allow your FSH to rise, which FSH rising is what triggers your estrogen to rise. So high prolactin means you don't ovulate, you don't have a cycle. So family history of lupus, depression, anxiety. I think there was some other stuff in there too. She does not drink at all. I live in a very predominant area for LDS religion, and they do not drink caffeine or alcohol. So when I say no alcohol at all, it really is no alcohol. No substances or tobacco. She works for a local school system, and she's a single mom. So she has had some history of emergent psychiatric care. We have something near us called the Access Center, and people can go there 24/7 if they're feeling suicidal or they're in crisis. But she has a long history of recurrent depression and trauma and sexual abuse and all kinds of things. And she's doing the work. I'm a huge advocate for mental health and doing the work, because I can give you all the medication in the world, but until you sit down and do the work, it is just going to be a long road to hoe. So I'm a big advocate for that. And if you guys end up reading the Gabor Mate book, or there's another book that I talk about endlessly. What's it called? I'm looking here. The Body Keeps the Score by Bessel van der Kolk. And that is about how your body remembers physical trauma and physical illness and things like that, and how that affects your body. So it's a really wonderful read for that too. So there's actually studies that show individuals who go through a traumatic event, who are raped or molested, it messes with their cortisol response system and their recognition system. So they are not actually as able to recognize dangerous situations because their activation system is just completely dysregulated, which is way too complicated for me to go into now. Yes, Sydney, I need to become a bookworm. I love that book. I love that people have read that book. So exciting. Yes, I have read The Mind-Gut Connection. You are very right. Okay, so I'm going to go back because I did these in the wrong order. Sorry, guys. So her sleep is just terrible. We tried to wean her off the Ambien, and she was doing really well. Like, she was doing great. She was improving her nutrition. She was walking 5 miles a day, and she was feeling really great. And then she kind of had like this traumatic relapse with this sexual assault, and everything kind of just reset. For stress, I have constant. Her nervous system is just continually activated. It's a really, really hard thing to get people out of that, that activation system. And like I said, she recently left an abusive marriage. She relocated back to the area that I'm in now in St. George, but doesn't really have like a ton of support, unfortunately, directly in the area. Okay. So differential diagnosis, like I said, she was previously diagnosed with PCOS. She is someone who could have endometriosis, for sure. Some of these are not fancy diagnoses, like low progesterone, still a diagnosis. Hypothyroidism, which she already has, premature ovarian failure, nutrient deficiencies, any type of autoimmune disease. So let's talk about hormones and workups for a second, like what I did with her. You cannot test female hormones when a woman is on birth control. If it is a hormonal contraceptive, it shuts down ovulation, and you cannot accurately test hormones. I cannot tell you how many times I see physicians doing this, like women are on the pill and they're testing their hormones. And I'm like, you are going to see postmenopausal levels because it literally just flatlines you. Like you don't have any spike, you don't have any raise. So if they're on a hormonal contraceptive and they're on it for contraception and they want to stay on it, can't test their hormones. You can't do it. It's not like what are you going to do with that information? You're not going to do anything. You can't do anything with it. It crushes my soul. Like, I hope people know that it really can tell that it crushes my soul. You need to know what day of a cycle a woman is on. So I'm actually doing a certification right now to help women track their cycles through cervical mucus, basal body temperature. This is not the rhythm method of your parents, people. This is not the same thing. And different signs and symptoms and how fertility relates to our health. Because if you guys didn't know this, your period is your fifth vital sign. Your menstrual cycle is your fifth vital sign. Your menstrual cycle is the whole thing. Your period's when you bleed. So when I ask patients a lot of times, like, how long's your menstrual cycle? They'll be like 4 days. I'm like, no, that's your period. What's your menstrual cycle? So days 19 to 22 is the rule of thumb. If a woman is having regular 28 to 32 day cycles, if they are having say 25 to 26 day cycles, they need to move it up more. So instead of on days 19 to 22, it needs to be more of like days 17 to 19, because what we're looking for is that peak in progesterone. And if we test too soon or we test too late based on a woman's cycle, we're not gonna get an accurate gauge. And all women do not ovulate on day 14. It is very variable. And I could get into like luteal phase defects and all kinds of stuff, but that's just going to go too far. But so, and then if you're having longer cycles, so if you're having cycles like 31 to 33 days or 34, you're going to want to test like days 22 to 24, 23 to 25. So it really takes a couple of cycles to know really when you should be testing that specific woman's hormones. I'm not against birth control in any way, shape, or form. I think that everybody has a right to choose what they want to do with their body in any aspect in medicine, 100%. I don't care what I think. I care what my patient thinks. I care what is best for them, and I care what they want, 100%. But birth control does not regulate a menstrual cycle. You see that everywhere. The fact that it shuts down ovulation confirms that. And you hear that everywhere. You hear that from so many doctors and so many gynecologists who say, let's regulate your cycle. We're not regulating anything. We're giving you a withdrawal bleed. And this is not other allopathic providers' faults, 100%. We are not taught this in PA school. They're not taught this in medical school that I know of. It is not taught in nurse practitioner school. It's taught to give birth control for everything. So I'm really super passionate about female hormones and just educating women to know like, hey, like this is really what's going on with this. And you can do whatever you want and make whatever choices you want, 100%. But I just want you to have all the information. I want you to have every single piece of information that you can have so that you can make the best decision for you. So that's just my little sidebar on hormones. I don't know if that was warranted, but we went there anyway. So what did I order for her? So I did my favorite test is really the Dutch test. It's a dried urine cortisol test. And it looks at the metabolites. So estrogen actually has multiple metabolites and multiple, so there's like E1, E2, E3. So it gives you the best reading. But they are super freaking expensive, y'all. These tests cost like $500. So for a lot of people, it's not reasonable, unfortunately. If anybody wants to look in the Dutch test, Precision Analytical does them, and they're amazing. But I ordered estradiol, progesterone, a full testosterone panel. I have it delineated there. You guys can see free bioavailable total and sex hormone binding globulin. Sex hormone binding globulin is protein, escaping me right now, but it is a substrate that other hormones can bind to if it's high. So if you have a lot of sex hormone binding globulin, even if your estradiol, progesterone, or testosterone is normal, your testosterone, it can grab onto that. So you can get a false read on not your estradiol and progesterone, but what your testosterone is if your sex hormone binding globulin is elevated. DHEAS is another androgen produced. That's important. That really is more related to a woman's sex drive primarily. Prolactin, as I talked about before, can be elevated. There's a lot of medications that can that can elevate prolactin that can cause issues. Full thyroid panel, vitamins, and then transvaginal ultrasound, which was negative, and I didn't list that there, but it was negative. So the most common pattern that you're going to see on any female hormone panel is low progesterone. It is the #1 reason for miscarriages in the first trimester. It is also usually the culprit for any type of menstrual cycle irregularity. And she also had, a more of an estrogen dominance or a higher estrogen level. So symptoms of estrogen dominance are going to be like breast tenderness, like, crying, very moody, very emotional. Hers was not super, super high, but her ratio probably would have been a little bit elevated. Low vitamin D, again, get in the sun, people. Low magnesium, super important for the menstrual cycle. So I don't know what's going on with her yet. This is probably not the best case presentation, but it's the truth, because she's got so much going on right now that we haven't really been able to focus on her hormonal health. We're really focusing on her hormone health and really just trying to bring her down and have her do the things that are serving her right now and not get super complicated with the rest of her health. So I haven't gone through this treatment with her yet because, again, she's just not in a place where she's going to be able to handle this. And you need to prioritize the things that you're doing with your patients. So I love Vitex for low progesterone. So Vitex is an herb. It's called chaste tree. You do it for 3 cycles. And when I say cycles, I mean 3 menstrual cycles. So take it when you're not menstruating and take a break from it, and don't do it any longer than that, is how it's told to be given out, to write it out. Same vitamin D supplementation. Magnesium I love at night because it kind of makes you relax. Can be used as a sleep aid. I love giving it to people for sleep. Relaxes the nervous system. It's really good for your muscles, nerves, that type of thing. Focus on sleep. Sleep is where all the magic happens, you guys. I didn't say this earlier, but if you're not sleeping 7 to 9 hours a night, it's really hard to make improvements on things. And just those foundations of health that I talked about earlier, if you're not doing those things, it's really hard to make progress. And mental health therapy, which she's doing all the work. I feel awful for her, just because I feel for her. She's had a really rough time, and it's the whole hormone thing is because her stress has activated her cortisol is high, and when cortisol is high, it messes with the rest of your hormones. Nicole Jardim has a really great book called Fix Your Period. Her name is Nicole Jardim, Jardim, and she kind of goes through a lot of common period problems, and how cortisol is really, she calls it the mother hormone, and I 100% agree with her. It is in charge of everything. So I don't have any resolution with her yet, but I think that it's really important. It's really important, I think, to have an understanding of really how women's hormones need to be tested, even if it's just a small introduction that you guys are getting for if you do go into practice family medicine or women's health. Those things are not commonly talked about. And I haven't gotten this way to this point with her, but I would recheck hormones in 3 to 6 months. lots of nutrition and lifestyle changes can make a huge difference in your hormones too. Just eating whole foods, getting rid of processed foods, vegetable oils are a huge culprit, huge culprit. Recheck her Meg and D, mental health check-ins. Like I see her probably on a monthly basis, just to see how things are going. Get her to the dietitian, try to make some of those lifestyle changes. I don't think she's met with the dietitian yet, just because again, you know, it's just been a hard time for her. Let me see what I've got. Oh, so many birth control questions that I love, but I could talk forever on this. Oh my God. My boyfriend's probably in the next room going, I already know too much about this. How long do you have to be off hormonal birth control to test your hormones? So that depends on when you get a cycle back. So, and everybody is different. So some women go on birth control and come off of it and they don't have an issue. Most women I know, it takes a little bit of time. I do, you know, to get your cycle back. And the rule of thumb, and there is no black and white, you know, medicine is a huge gray area, is 1 month for every year that you've been on a hormonal contraceptive to get that cycle back. Once you have had 3 to 4 consistent cycles, meaning they're happening within 2 days of each other. So you're having like a 25, 26, 25, 26 cycle, somewhere in that 2-day range. I would then be like, okay, like I know what my cycles are and when I can test my hormones. The other thing that you can do is if your cycles are a little variable, your patient's cycles are a little variable, if they're like 24, 28, if they're taking their basal body temperature, it has to be done with a thermometer with 2 decimal points at the end so that it can be tracked. But if they would want to check on days 5 to 7 of that consistent temperature rise, because when you produce more progesterone, your body temperature rises naturally. So you're going to see that it just, dip, dip, dip. You'll see a spike when you ovulate and then it'll just continue to climb and go boop, boop, boop. So that's another way that you can kind of look at that. Did you consider OB-GYN? I did. I get bored really easily. I like to see a lot of different stuff. I love to talk about nutrition. I love to help my diabetic patients. I love to help my mental health patients. I love everything. And so I cannot settle on one thing, you guys. It's really hard. I work at a gyno and it's the first time I'm hearing this. Listen, I read a note from a gynecologist that said, we're going to try this patient. I didn't believe the patient, so I read the note. We're going to try this patient on birth control for 3 months to regulate her cycle so she can try to get pregnant. I'm like, huh? P4. I don't actually know what P4 is. I'm assuming that's some type of natural compound of progesterone, but I love a good compounding pharmacist and natural bioidentical hormones. Yes, I'm a fan of that. I have a lot to learn on that. It is on my list of things to do in 2021, y'all. Oh, lack of insurance and healthcare. Oh God. It's a whole other conversation. Vitamin D makes me have insomnia. That's a different one. I don't know on that one. That's the first time I've ever heard that. So can Vitex be given if someone is having very irregular periods or no periods? I do not recommend. I am always test, don't guess. Nothing should be thrown at a patient, whether it's natural or prescriptive, without doing a test. So I would not recommend that. Can a PA student go on 6 hours of sleep? Are you asking for a friend? It's not recommended. I was such a baby about my sleep. I always have been. I'm like, Gam needs to get to bed here. I go to bed super early, but yeah, prioritizing your sleep is super important. So the certification I'm doing is called FEM. So it's Fertility Education and Medical Management. I think it's FEMhealth, FEMMhealth.org. They have multiple courses throughout the year if you want to go and learn more about that. That is super. We need more people out there talking about this. If you don't have another time today, you should do another video about it. Even though I just met Danielle, I trust her with my life. Oh God. Thank you. That's very sweet. So you meant progesterone, not PR4. I'm like, I don't know what PR4 is. What's a new one on me? But okay. Yes. I'm totally for it. Are your clinical decisions guided by CPT codes, what you can bill for, what insurance covers, what you think the patient can afford? How much do dollars dictate your decisions? So we actually are just switching over to value-based care. And I was like, I don't even know what that is. The most important thing to me is like, what's realistic for that patient? What can they afford? What are they going to do? What are they going to follow through with? The only time insurance that I honestly ever pay attention to it, like people say this is idealistic, but I honestly don't look at a patient's insurance until it comes to mental health, because mental health, Medicaid does not cover mental health. And it drives me cuckoo because there is one resource here for it. And it just doesn't give patients the options that I feel they truly need. And I feel like if mental health and trauma were really addressed more, that we would have, those people would utilize the healthcare system so much less. So it does not dictate my decision-making. I naturally turn a blind eye to that. I know that may sound phony to some people, but let me tell you, I don't have a phony bone in my body. Like I cannot bluff anything. Like I have no filter. I have just enough filter between my brain and my mouth to keep me employed and not arrested. Is there a way to diagnose endometriosis besides surgery? No. Hard freaking pass, y'all. If someone comes to you and says that they were diagnosed with endometriosis and they didn't have an XLAP, someone didn't do their job as a provider and they practiced lazy medicine, and that ticks me off. How does call work with family medicine? So I get a lot of things. Like I had an elevated INR earlier and an elevated bilirubin for a newborn baby. There's 6 of us in our practice and we rotate every 6 weeks. 2 calls in a night is actually the most I've ever had, and they both happened tonight, of course. It's pretty light. It's easy. I don't mind doing it. When it comes to cycles, is it no longer a concern if your cycle went from abnormal to normal on its own? When should it be a concern? Oof, that's a loaded gun question. So it depends, again, with anything in medicine. So your period is your 5th vital sign. Like I said, if you're having period problems, your patient's having period problems, that's a problem. That reflects your health. Like, so I'm going to give another patient example. You guys can cut me off at any time. But I'm going to keep going with this. I have a patient who came to me, super, super sick lady, very obese. Like I'm talking like over 400 pounds, liver failure, cirrhosis, prior drug addict, just all the things. She had not had a period for 800 days. I have this lady down, like she's got herself down, like almost 200 pounds at this point. She's her iron deficiency is coming up, her magnesium came up, her vitamin D is coming up. She got a period. And it's because her body doesn't feel that stress anymore. Her body's getting healthier. So it was like, oh, maybe I'm safe to ovulate and put something in this, some bun in this oven. If you are not healthy, your body will know that you are stressed, and it is not a safe environment for you to have a baby as a woman. So abnormal cycles, painful periods. Let me put it to you this way. If you had knee pain and you went to your doctor, they would probably evaluate why you had knee pain, right? Like, is it swollen? Is it red? Is it hot? Like, did it go away or does it keep happening? But for some reason, when women bleed extensively with their periods, or it just hurts like hell, people are like, yours is fine, no big deal. No, it's not okay. Like, it's not normal. It's not okay. So yeah, 800 days. She was super unhealthy, but she's doing great. And she's also one of my favorite patients. I love her. I see her also kind of on a monthly basis right now. And she is literally one of my favorites. She's killing life right now. Enough filter. Literally the speed bump between here and here, very teeny. Is your position completely autonomous? So billing wise, no. I see patients just like my doctor does. I have developed a relationship with him and he is amazing. I am so fortunate to work with a human being who is so supportive of me and so appreciative of the things that I do and the way that I care for patients. He knows that I know when to ask for help. And he is always there. Like, if I need to call him, he's like, when you're on call, if you need anything, you just call me. Like, I work in an amazing freaking practice and I am so fortunate and lucky to be in the position that I'm in right now. And I worked, and not lucky because I worked hard to get where I am. No, someone on birth control can't have high estrogen. That would be a weird situation. I've never seen it. That doesn't mean it can't happen. Maybe there's something wrong with that person, or I don't know. I've never seen that. Valeria. That's a long discussion. What the treatment for for PCOS besides birth control. I start with the simple things with people. If they have a crummy diet, if they have crummy sleep, if they don't deal with their stress, if they have unaddressed mental health disease. I know a lot of providers out there don't think that those things are related, but I am a very huge believer that everything in our bodies are connected, mind, body, spirit, and I'm not super religious. I say that just so people don't think I'm like some, whatever. Anyways, those things are important. So fun fact about PCOS. So PCOS is a very testosterone driven disease for the most part, right? So you can also have PCOS without having cysts on your ovaries, and cysts on your ovaries can also be normal. So it's really a poorly named disease, and they're actually trying to like rename it. But so you have 4 generations of progestins in your birth control. Some of those are, like I said, more similar to testosterone than they are progesterone. There's progestins and there's progesterones. Progestins are the synthetic compound that is in birth control. So if you get on a birth control pill that has a compound that's more similar to testosterone, it is actually going to exacerbate your PCOS. So if you don't have a provider that knows what they're writing for, and I have a list of these because I don't remember them. I'm not that good, people. But I refer back to it. If I have a gal who doesn't want to be pregnant, she wants to take the pill, I'm sure as heck not going to give her the one that's more similar to a testosterone. Dr. Sarah Hill, she has an awesome book, and it is called Your Brain on Birth Control. She is a neuroendocrinology researcher, PhD researcher, and her book is phenomenal. It's a really good way to kind of understand what birth control, what it does, and just have an understanding. I try to be really neutral with everything with my patients. I guess this is like going into stuff you won't really learn. I should probably get on track, but really matters. What I think doesn't matter, to my patient care. Like, I don't want to take birth control, but that doesn't mean it's not the right choice for my patient. So I really, we all have biases, and that is one of mine. And I really have to watch that when I go in with a patient. And I tell them, like, listen, what works for you is the most important thing. Cause I will get asked that question. Well, what do you think? And what I think doesn't matter. Here's the information. You need to make a decision that's best for you. It depends on the patient. So if they have all of those things in line, I don't know. I got to see labs. I got to see 100 other things before saying, like, what do you think is causing this? Have you ever felt your job was ever too much or it was overwhelming? No. I have a really good work-life balance. I know that's like kind of a buzz term, but I do. And I'm really fortunate for it. When I go to work, I'm happy to be there. I love what I do. What resources do I use? I love Up to Date for like traditional medicine stuff. You could be having adverse effects. I'm a provider, but I'm not your provider. This is not medical advice, people. Like, disclosure. Should have put that in my disclosures. I'm not giving medical advice. I'm giving just opinions. Okay, so a note on normal lab values. A lot of the times I see a lot of things where people are just like, it's normal, it's normal, it's normal. But people are just like hanging on by a thread and they feel like garbage, like vitamin D, for example. If they feel like garbage and they're hanging on at 30, like maybe they need to take a vitamin D supplement. I really like to see people in optimal ranges. Again, I follow more of that functional medicine ideology than I do, allopathic with the lab values, doing the full thyroid panel and that stuff. So, you got to listen to what your patients are saying. Like, if everything's looking normal, and this is not all of the time, a lot of the times I will do, if I do a full workup for somebody's complaint and something is still going on, then I'm having the conversation of what's going on with their mental health. Because again, not that people are crazy. I don't think people are crazy at all. And I don't think they're making up their symptoms. But what goes on in your mind affects your body 100%. So then I'm starting to have that conversation of, is there something else we need to address? Is there something we're missing? This actually happened with a gal. She was 44-year-old girl who, I went through that. I mean, man, she had nausea, vomiting, all these weird symptoms, and I could not find a thing on her. I could not find a thing. No autoimmune markers, no thyroid, no celiac, no vitamin deficiencies, no hormone levels abnormal, no nothing. Come to tell me, she's like, it came out in the woodwork that she had had 4 miscarriages that she had never paused in her life to deal with. That's a huge trauma. 4 miscarriages in a row. Holy smokes. So, you know, it's not always like a normal lab value that's lower. That's the problem, I guess, is what I'm trying to say. We talked a lot about nutrition and vitamin and nutrition and movement and just really leading a healthy life. I think it's a super important thing. And I think that's another thing that draws me to family medicine, because I can have a lot of those conversations and have an impact, like at ground level with my patients on, okay, what are we eating in our home and what are our eating behaviors? And maybe just, you know, try to keep the tempting food, most of it, out of the house. And so you have to go out and it's a treat or something like that. Like, I go over a lot of stuff like that with my patients. So So about PA school, do not listen to people's horror stories. Like, it is hard. Don't get me wrong. It is very difficult, but you will get through it. There are people that don't. We had one person fail out, but if you try and you care, you will make it. Keep your eyes on your own path. Don't pay attention to the other person who has 90 umpteen bajillion hours of, you know, patient care and you only have the minimum. Doesn't matter. If you have a minimum, you're probably going to get an interview. Like, that's just the way it is. They interview a lot of people. I think it's really easy to get caught up in that stuff. And I'm thankful that I applied to PA school in like late 2012. And social media wasn't as prominent there then. And it wasn't just all in your face. And I think that was really helpful for me, because if I would have seen the qualifications of the people in my class, I'd have been like, there's no way I'm getting in. Fun fact, I had a 2.9 undergrad GPA. I did have a master's degree in counseling that I did very well in, and I did very well in my prereqs, but it does not prohibit you from succeeding. And my GRE also sucked. Don't remember what it was. Don't remember the scoring system. I have PTS'd that out of my life. I have no idea. But my score was not good. But I was persistent. I showed up at all the open houses. I went to the University of Pittsburgh and I showed up at the open houses, and one of my professors remembered me from the open house because I came dressed in a full suit, and I handed her a resume and a thank you letter for like doing this. And she was like, I remember you. And I'm sure shit, that's why she remembered me, because everybody else there was in like jeans and flip flops. Don't listen to the people who say they don't study, and don't be that person who says they never study. We all know it's a lie, and we all find it annoying. Do other things besides PA school. It's important and it should be your priority, but other things are important. You know, make sure you're addressing your mental health, make sure you're doing things that bring you joy, and that you're getting sleep, because your brain does, I don't know, my brain does not function on no sleep. So I was really pretty strict about that. Besides like finals weeks, I was usually in bed by 9 o'clock. I was literally the grandma. Keep an open mind. Like, I thought I was going into trauma surgery or orthopedic surgery. Neither of those things happen, obviously. Never worked in surgery. Don't think I'll ever work in surgery, but my whole point in that diatribe is just keep an open mind, because you never know something that might spark your interest, or that might spark joy in you. And if it sparks joy in you, you will love it. Like, I don't ever complain about going to work. And especially after this year where so many people lost their jobs, I definitely don't complain about my job ever. Yeah. So if you guys have a couple of minutes, I'll answer like a couple more minutes of questions. If you guys want to connect with me, my email and my Instagram are pretty much the same. I like to put up fun pictures because I'm not a boring person, I guess. Like, the one professional picture was enough for me. Love your honesty. Yeah. Like I said, my podcast is called Strong and Unfiltered, and literally like there's no filter. How many people did you get to review your personal statement? So I used to review people's personal statements. Like before, like the days of influencers, I had another Instagram account, but I've just become so diverse in the things that I do that I'm like, I am not all about one aspect of my life. Like being a physician assistant is a part of my life, but it's not all of it. I had one girl who, and this is how I got the idea to do personal statement reviews. And she helped me so much. And I remember her first name was Melissa. I don't remember her last name at this point, but she was so helpful and I'm so thankful for her. Again, I applied in 2012 before everybody was like charging $400 to review a personal statement. I support capitalism, but I had a hard time. I did not charge people that much because I was like, I know what it's like to be dirt ass poor before you go PA school. So I don't, my Instagram really isn't all PA inspired. I should maybe change the name. There's a lot of different stuff over there. You'll see my dogs. You'll see there's a lot of mindset stuff. I do like I do some PA stuff and pre-PA stuff still. I'm so glad I made you feel more confident, Cassidy. Don't be discouraged. How did I find such a fab supervising physician? I have no idea. He's so wonderful though. He's so wonderful. What's the best advice? Looking for opportunities such as patient care hours and determining which ones are best for you. I was a mental health therapist. I'm not the best resource for this question. I would say whatever you can snag up at this point, because jobs are hard to come by still in a lot of places. If you can get a job, I know working as a CNA just sucks and it's hard. Like it's just hard grunt work, but I would have been better suited and better provider coming out of PA school had I been a CNA. Truth. Oh, you're welcome, Morgan. How do I like Pitt's PA program? I liked it. I was one of the first people to go through it. They've made a lot of changes. I was back probably 2 years ago, and they've started to add a lot of things that I think are really important, just like procedurally, like different procedures they're teaching and stuff like that, excuse me. Best advice for low undergrad GPA, be well-rounded. PA schools do not want just someone with the grades. Like you can have a 4.0 or 4.5 or whatever GPA, and you can be a total, like you can have no social skills. If you can't connect with people, if you can't empathize, like you're gonna have a hard time doing this job. Like it's just the way it is. Get more patient care hours, do more shadowing. I was so aggressive. I don't even know that I can say I was assertive. I was literally probably aggressive. And anyone that I interacted with, I'd be like, do you know PA? Do you know anybody who knows the PA that I can shadow? I had really diverse experiences. And to this day, I say that they looked at my resume and were like, this girl's really interesting. I have no idea what she's about, but we should just see what this comes out as. I was a bartender. I worked as an anesthesia aide. I also worked as a mental health therapist. I was a bartender at the time, if I didn't say that already. What else did I do? I think there was something else. I can't even remember at this point. Farm tech. Yeah, I mean, farm tech can help you learn a lot about drugs, like me learning drug names. I'm still like, I don't like when I'm queen of the world, all the medications are only going to have one name and all the patients are going to be able to pronounce them properly. Where do I see myself in 5 years? Oh, that's a hard one. I mean, we have like a 9.5 year more plan for it to be where we are right now. That's actually when my doc retires too. But we just bought a house and stuff. And then, I don't know, we've talked about other stuff, like maybe me going back to locum work and going to Alaska for a year or Montana. I don't know. We'll see. What are your thoughts on IUDs? It depends. It depends, like so many other things. There's different options for IUDs too. So for someone who is not wanting to track their cycles and who absolutely doesn't want to get pregnant, you know, the copper IUD doesn't have any hormones, so I love that option. But a lot of women do really great with, you know, with the Mirena. I see more problems with the Kyleena, to be really honest. I don't know if it's just the people that I've seen, but I've seen more people do better with the Mirena than with that. So I think if it works for someone and they definitely don't want to be pregnant and that's the option that works for them, rock on. Full disclosure, I'm 36. I never want children. So I totally support people who want to use contraception to not be pregnant. Tips for interview. Be confident, be assertive, and show them why they should choose you above anyone else, period. Pros and cons of doing locum work. The pros, you get more money. You get your housing paid for. They pay for your travel. They pay for a lot of other stuff. I got a lot of money out of a lot of things from people. Most of them, besides Comp Health, don't pay for health insurance, and you don't get like 401k and other benefits and stuff. So it's a give and take. You definitely don't get paid time off. I get a crap ton of paid time off right now. So I have like, I think 5 weeks of PTO a year and then 5 CME days. And then I have also 11 paid holidays. So I'm probably better off now than when I was doing locum work because I like to travel a lot. I need to be aggressive as you as finding P to shadow. Listen, just go door to door. It's fine. Oh, Christian, I don't know. What are the requirements now? I don't know what people have these days. I'm old. I went to PA school. I think somebody asked earlier when I went to PA school. I graduated from the University of Pittsburgh 12, 13, 14. So December 13th of 2014. So it's been a second since I've been there. Oh, somebody said it's really good. Okay, it's really good. What else do you guys want to know about being a locum PA? I don't know what else specifically to say about that. It was fun. It was a really great way to like see different areas of the country and do different things that I probably wouldn't normally do. It's how I really got into hiking and backpacking and like really just immersing myself in national parks. I lived by Yosemite for like 9 months, which was like just nature bathing all the time. It was so great. I'm so old, Christine. Oh, but thank you. That's so nice. Yeah, go to the Bahamas. There's you can do 1099 or W-2. You don't get the choice. It's dependent on the company that you're taking the contract with. As a pharmacist do it, the names are silly. Locum for new grads. I had like 7 or 8 months of experience. I left my first job very early. It was a really great first experience for me because it kind of eased me I did medical management in a hospital for like non-medical patients. So like I managed people's medical problems who are post-op pretty much. But I had some issues with my dad did not pay these personal private education loans that I had when I was in PA school. And I came out of PA school to, on top of the other debt that I had, to $50,000 in collection. And so I dropped everything and I paid off $50,000 of debt in like 2 years because I was like, hell no, that's a whole other story for a different day, y'all. Why did I choose not to travel anymore? You get done with things eventually. I mean, you move every 3 months and it was wonderful. And it was such a great experience. And I loved that time of my life. I was ready to be done. I was ready to have a permanent job and have continuity of care with my patients, and for my boyfriend and I to live together after like 2.5 years of being together. We actually met like in college and reconnected. And if you listen to the podcast, that's episode 8. It's a really good story. Got a Ben and Jerry's ice cream ending for those of you hopeless romantics out there. But you know, I was just, I don't say that I was ready to settle down because I don't feel like I'll ever really be settled. I feel like when people are always looking for more and looking to be better, you're not settled. But I was really ready to not be moving every 3 months. And we actually just bought our first house. So I think that had a lot to do with it. I was ready. Does anyone have a PA admissions counselor? So do you guys know about my PA box? They like do all the work for you. They asked me to like become an ambassador for them, so I should probably like sign up so that like you guys can use my discount code. But it does all the work for you. They're like, if you don't want to take the GRE, you just like click the box of like, don't want to take the GRE or whatever. What exactly do you do as a locum PA? So you're on your, like, you hit the ground running. It's a lot of learning on the spot. I feel like it was really helpful for me because it really forced me out of my comfort zone. My first locum position was as a nocturnal hospitalist. And my one friend, Sharon, is probably one of the smartest individuals I've ever met. You guys should talk to her. Pre-PAPals, you should talk to her. She's a genius. She works in the ICU right now. She's been doing ICU work for a long time. And I learned so much from her. So I feel like I'm one of those people who I thrive on just being thrown into things. So if you thrive on like learning how to swim, you would do great at it. I did not apply to any of those scholarships. I am on the loan repayment. Yeah, so Dr. Jolene Brighton, Beyond the Pill, is a great read for that. I actually work with her team doing medical review articles. So she actually says all the time that she's not anti-pill. She's pro-informed consent. So the pill does have negative effects. I actually I can show you guys, but it's actually under my lamp here. Oh, is my PA box a lot of money? Thanks for the info. I don't know. All I know is it's like really convenient for things, but the pill can have negative effects. For some women, it works fine. That's why I say it really just depends. It really just depends on your needs and like how you react to a pill. And even if you do poorly on one pill, it doesn't mean that you're going to do poorly on another. The biggest thing is that my biggest issue is when the birth control pill is given for period problems, where we can really help women ameliorate those problems. Because when you come off of that birth control pill, those problems that you had when you started the pill are still going to be there, and they're probably going to be worse. And that's the truth about that. And that's a truth that isn't talked about in allopathic medicine. So that's my speech on that. Again, I'm not against the pill either. I think, I took the pill. I took the pill. I had the Mirena. I used all of those resources. So I am definitely not against it. I think there's just different strokes for different folks, whether it be medications you want to take or choose not to take, whether it be something you want to put in your body or not put in your body. Everyone is so different. We are all just different people. And I don't know. I've just really learned to honor and respect like whatever my patients want. It's not for me to judge or decide. And some people might just want to stay on the pill until they're 55, and some people might never want to use it. It's a really hot topic and it's really controversial. And so I really try to just approach people with kindness about it. And the same way I do about everything else. Like, it's just like diabetes. Like, I wouldn't want to take metformin. If someone was like, hey, you have an elevated A1C, you can either change your lifestyle habits or take metformin. There's some people who just want to take metformin, and it's not my job to judge that. It's just my job to give them the information and help them in any way that I can, so I don't know. That's probably another diatribe that people maybe not needed. Blood clots on the pill are real. They happen more frequently than people think. I've had 2 people that I sent to the ER in the past 6 months, young girls, both on birth control, both have PEs. Mental health psych resources for trauma, PTSD, reconfiguration of arousal. Ooh, I love the way you said that. So the books I said earlier are really great. So When the Body Says No, by Gabor Mate, and what's the other one called? I'm getting brain dead. The Body Keeps the Score by Bessel van der Kolk is really great as well. There's a book, something about the vagus nerve, because there's a lot of studies out there with traumatic brain injury and actually how that's affecting how people deal with trauma and just their anxiety and depression. They're doing a lot of fMRI studies on people who have just, combat veterans mostly, who have just been blown up by IEDs so many times that their brain is just so damaged from the TBIs. It's really unfortunate. But I can't remember the name of that book. There was a chiropractor who posted something about the vagus nerve, and I can't remember the damn name of the book. How many days a week do you work? I work 4 days. It's beautiful. I have 32 patient-facing hours, and then I have any additional time in my 40-hour work week to do any charting or calling patients back or anything that I need. I have a really great work-life balance. I'm super fortunate. Okay, guys, I'm going to take 3 more minutes. Was I a part of any professional organizations memberships? I wasn't. I'm now in the Utah Society of Physician Assistants or whatever it's called. I'm not very involved, obviously. I probably should be. Favorite scrubs. Oh, y'all, if someone can help me out here with scrubs for athletic bodies with like women with shoulders and lats, hook a girl up. I struggle. I cannot find. I've tried scrubs. I've tried all the fancy ones. What's the other one? Janu. I didn't like them at all. Yeah. Look into polyvagal theory and trauma. Ooh. Okay, we're gonna have to make a list of books. We're gonna have to have a book club. Hardest part about being a family medicine PA. Oof. You always have to be on your toes. Like, you can go from one situation where everything is just hunky-dory and great, like the day the patient I was talking about who came in and she had been raped and assaulted, like she was so worked up, and the encounter before that was just totally hunky-dory. My age is coming out with that saying, and probably my Hungarian side. Oh, that was it. Accessing the healing power of the vagus nerve. That was it. I don't have any workbooks. If people have workbooks or like resources for patients like that, hit me up. Figs look nice. They do look nice. I tried figs. They always get tight in my butt and thighs. It is a struggle. Like, I need pants for somebody that squats and runs. But a lot of people like them. I'm not knocking them. Research credit in undergrad. What do you mean, like a research class? Career-related interests outside of medicine. Probably someday. I have too many interests to limit. Barco 1 scrubs are super nice. Jordan, do you squat? Do you lift weights? Tell me. Number 1 advice for pre-PA students. Don't be intimidated and be a force, and go in there like you've earned it. Assertion gets you a long way in life. Oh no, there's a workbook that goes along with Body Keeps the Score. I'm very excited right now. Oh, you follow me on Instagram. Dino Nuggies. Guys, I have a problem with the Costco chicken tendies that are dino shaped. I'm an adult and I eat super healthy, but probably twice a week I'm having dino tendies. They're so good. And if you eat them plain without dipping sauce, you're definitely a serial killer. Anybody else? Last call. But yeah, guys, seriously, if you have questions, I will probably not edit your personal statements. I'm so busy that it is very hard for me. I still get people who ask me to edit their personal statements, and I'm super honored, and I really like doing it. But if you have any questions like related to being a PA or just about life or my practice or anything, connect with me, or just connect with me anyway, and like tell me that you like dyno attendees, because those are the people I need in my life. You guys are so welcome.
You're awesome, Danielle. Thank you so much for doing this.
Oh, you're so welcome. I love doing
amazing,
stuff like this.
Yeah, that was such an amazing session. Everybody loved you. Like, we love you. We love everything about you.
Oh, thanks. You guys are
so
great.
much good information there. Yeah, it was awesome. I mean, I feel like the big takeaway from this is just how much you actually care about your patients, which is so refreshing to see.
Yeah.
You know, like,
yeah, for sure. I guess the thing I should probably leave people with is there's two principles that I use in my practice, and I can't believe that this got away from me, is if you were my loved one, what would I want done for you? And if you have a loved one at home who works in medicine, I want them to be able to say that I did everything possible and I did it the right way.
Oh my God. Yeah,
So.
that's incredible. It's advice like that from people like you that, like, you know, this is the reason that this platform is incredible, because 300 people here, biggest session we've ever had. If everybody can just take that away from the session, like, it is going to be, the healthcare world is going to be a lot better place. So definitely made a difference.
I hope so.
We thank you so much.
You're welcome.
Like, you're incredible.
You're welcome. Anytime. I love it.
Yeah, we'll plug your Instagram. We did it earlier, but we'll put it into the chat so that way you guys can click it and make it a little bit easier. Podcast everything. We're very pro Danielle. She's awesome. So anytime you want to come back or anything like that, if you want to reach out to us, we're always here for you.
Take a poll. I love it.
I mean, I can't believe you're offering your email. I'm sure you're going to get blown up. Like, this is such a huge
That's okay.
Yeah, like, I mean, what other way could you connect with somebody so personally? Like, that is insane. Like, you're awesome. So seriously.
Yeah, just be patient with me. If I don't get back to you, I'll get there. But be patient if I do get bombarded.
Yeah, I mean, geez, 300 people here. I bet you're going to get exploded. But
Aw.
But well, thank you
Everybody's
so much.
Great. Yeah, you're welcome.
Yeah.
Should I hang on, or are you just stopping our live, or what?
Well, we usually just drop the quiz in the chat and then hang around if anybody has any questions. But yeah, definitely, if you want to hang out, or, I mean, I know you've been here for like 2 hours already, so we don't want to kind of do that anymore than we already.
I'll hang for a couple minutes in case anybody like pops any last questions in.
Okay, cool, awesome. So
I'm just making sure I didn't get any other calls.
Oh yeah, for sure.
Yeah.
But yeah, guys, thank you so much for joining. That was an amazing session. Thank you again, Danielle. We're about to drop the quiz in the chat right now. And as usual, that'll be 5 questions. Super straightforward, nothing tricky. We just want to make sure you were here and attending. We keep it open for an hour just to, you know, kind of promote the validity of this kind of thing. We want to make it as close to shadowing as possible. So we don't want to make it so that people can go back and take like 20 quizzes, you know, later on and not actually attend the sessions. We want to be respectful of awesome people like Danielle who are taking massive time and effort doing this kind of stuff. So
I love it.
But yeah, I'll let you guys know when the link is live.
Just check.
Wow, everybody's so nice. You guys are all so welcome.
It's unbelievable. The best community.
Yeah, everybody's so nice.
So cool.
So sweet.
Yeah, I love doing stuff like this. I was gonna tell you guys, like, anytime you want, I'm in.
Yeah, we'll take you up on that, definitely.
For sure.
Yeah, we can do a follow-up session. It seems like there are a lot of questions and a lot of topics that you could talk on. Okay. So the link for the quiz is in the chat, and we will be sending out certificates. Usually takes about a week, right?
About a week.
That's a lot of people.
Oh God, tell us about it. So
you guys are gonna need to start like hiring somebody.
Yeah, I mean, it was never supposed to get this big, but the fact that it did is just like, you know.
No, don't limit it. Never set limits for yourself. Like, just let it go.
Oh man, just
you know.
Yeah, definitely. That's something that I need to work on, is the confidence thing that you talk about all the time. So took some of that to heart. I was like, yes, tell him. Like,
yeah. I'm like, I'd have to be like mindful of that and be like, okay, am I being assertive or aggressive here? Like,
oh, sure. Yeah. But yeah, guys, so so give us about a week. If you haven't seen your certificate by then you can email us or contact us Instagram. If you have any
not me for the certificates.
No, not her. Leave her alone, please. She's done enough.
Email me for other things, not the certificate. So, all right, cool, guys. Well, I'm gonna sign off here if that's all right. Thank you for having me, and thank you guys for attending. And like I said, connect with me for sure. Ask me questions, and even if it's just to tell me that you like Dino chicken tendies, like I'm all up for that.
All right. Well, we'll definitely be in touch. We wish you the best in everything. You're awesome again, and thank you so much.
Thank you.
Yeah, I'll talk to you guys soon. Have a good night.
All right. Take care. You too. Thank you.
See ya.
Cool. But yeah, guys, we may turn off our video here in just a second, but we will still be in the chat. We'll be hanging out right here. If you guys need anything, have any questions for us, personal about the quiz, about next session, whatever, we will keep you posted. We don't have an exact date yet for next week, but we should definitely have a session next week. I know it's a new year, application cycle's coming up, COVID's still around, people want to experience, shadowing, this kind of stuff, and we're going to be able to put together a lot of good presentations for you. So stay tuned, guys. We'll get you those hours. We'll get you this really cool experience. So we'll be here for you. Just let us know if you need anything, guys. Thank you so much. We appreciate it. We'll see you next time, okay? Yeah.
Hope you guys enjoyed your holidays, and Happy New Year. It's a little late, but Happy New Year.
Yes. All right, guys. Thank you so much. Y'all take care.
Bye.